Episode 3 Hardcast podcast. I am Brian Baker. This is Dr. Trent Kerr coming at you. This is the third week in a row.
I am shocked we made it this far. This is 2 years to get number one in.
2 years to get number one in. We've got number one and number two. And I tell you what, we've got like 250 viewers each episode. It's crazy. We want to thank you guys for supporting us. This morning, we have on tap Casey Stoneberger. All right. He's a doctor of physical therapy. He runs DFD, Denver Fire Department's physical therapy department. He's in charge of that. He's the head. He'll be popping on here soon. He's coming on right now. Trinity's going to bring him on. There we go. Dr. Stoneberger, can you hear us?
Yes.
Okay.
Brian, hi.
How are you doing? We had some technical difficulties. They worked through it, popped right back on. Casey, we want to welcome you. This is Dr. Trent Kerr.
Casey, how are you? Nice to meet you.
Hi, Trent. How are you?
Good.
So basically, we're just kind of introducing this episode, introducing you as Dr. Stoneberger. You are the head of Denver Fire Department's physical therapy division. You're in charge of thousands of firefighters tasked with trying to keep them healthy, keep them at work so they can help the community that they've been sworn to serve, correct?
Yeah, we started back in 2015. So on January 15th, that'll be 8 years of service here at the Denver Fire Academy.
Awesome.
That's impressive.
Awesome. And Casey, am I correct? You did your undergrad PT work at UNC, then continued on to get your doctorate from Azusa Pacific. Is that correct?
Yeah, I went to Northern Colorado, and from 99 to 03, I did a double major in exercise physiology and nutrition.
Wow.
Took a couple years off, had a brief dream of being a firefighter.
Sure.
And then decided I want to go to PT school. So I went out to Southern California to, just get a different experience. And I went to Azusa Pacific University and completed my doctorate work there.
Dr. Stoneberger, before we get into anything, at our house, my wife is a UNC grad. Can I hear UNC Bear chant? Can I get a little UNC Bears? We get a little of that going on?
UNC Bears. All right, man.
There you go.
I tell you what, I've got a doctor to my right. I've got a doctor on here. It feels like that Spies Like Us scene where it's like, doctor. That's what it feels like to me. I'm kind of the odd man out, but we'll see where we go from here. I got a lot of questions. I'm excited for this episode. I know we're pressed for time, so we're going to get as much in as we can. What got you interested in being in physical therapy?
Well, it might be interesting to you, but in my line of work, it's probably not interesting. I was an undergrad. I was finishing up my schooling. I didn't know what I wanted to do. I wanted to go to DO school. I wanted to go to PA school. I wanted to go to PT school. So I had all those things on the table. Towards the end of my rugby career up at UNC, I suffered a shoulder injury and I did some physical therapy, kind of fell in love with it. So I started going down that road. And as I was doing that, a bunch of my rugby buddies decided they wanted to be firefighters. So they all started testing and doing the work. So I did an EMT, I did an IV cert, started doing ride-alongs. And I've quickly found out that I could get in and out of PT school before I'd ever get hired as a firefighter. Some of these guys test for 5 to 8 years. So I chickened out and I went to PT school. And yeah, the rest is history. So
how did you get to play rugby at UNC? I didn't even know they had a team, man. That's awesome.
Right. So if you're not good enough to play football or wrestle for UNC, you play rugby. So, a bunch of us old jocks, we got together. We still wanted the camaraderie. We still wanted to train hard. We still wanted to compete. So UNC had a pretty good club rugby team up there. So there was a bunch of us. We got together and we decided to take it seriously. And, we trained together, we ate together, we would do 2-a-days together. We practiced every day. And by my senior year, we made it to a national championship.
Wow.
That's us.
Sorry, we're in school.
And at the end of that run, the the rest of that team, that was the underclassmen, they went to the national championship the next 3 out of 4 years. Wow. So it was, you know, it was a lot of fun. It wasn't a varsity sport, but we treated it seriously. We still got to have a good time, and got all the benefits of, you know, training hard, playing hard, and working together as a team. So
was that kind of like driven by you guys, or did you have coaches? How'd that all work? Because that's impressive. You say you went through 2-a-days, and all your guys showing up and making it for 4 years.
Right. So I mean, the team was made up of a bunch of ex-jocks from all over the state. A lot of us were from Jefferson County. We had a big group of guys from the Western Slope as well, from the Montrose area, and we all grew up playing football, wrestling, and we found each other up there, and we said, hey, we don't want to just do this just to do this. Let's take it serious. Let's have some fun with it. And you know, it was the right group of guys at the right time, and we'd be in the gym at 6 a.m. together at the rec center training. We'd be in the weight room together training every day, and we'd be on the field every day, or the pitch every day, you know, drilling and practicing every day too. So games on Saturdays, Kegers Saturday night.
Yeah.
And then take Sunday off.
It's still college. It's still college.
You guys did it right, getting up. Yeah.
It was a good fit for us. We trained hard, played hard, and you know, got decent enough grades. So
it was enough to get into PT school and become a doctor.
Right.
Yeah.
Right.
Doctor.
Yeah.
Whether you a student doctor or a C student doctor, they say you're still a doctor, right? Yeah. So that's pretty cool. I tell you what, well, I appreciate what you guys do at the Denver Fire Department. You guys have kept me a number of times online with knee injuries, shoulder injuries, plantar fasciitis. Go in, get acupuncture, massage. What do you guys all offer there to the Denver Fire Department guys to keep them going?
So, I mean, we practice physical therapy, but we use all the tools in the tool basket. So we use dry needling, we use joint manipulation, we use soft tissue work or instrument-assisted soft tissue work, you know, joint mobilizations at any grade that you need. And then, you know, we do all of those things to get you feeling better so that we can introduce you to therapeutic exercise. Start at a low level, or maybe work on some areas you're not too aware of that'll kind of help support what you're trying to do. And then if you need to be coached on bigger movements or bigger functional tasks, we can take you down into our gym here and go through all those compound or core lifts with you, or we can take you to the drill ground or the CPAT shed and work on forcible entry, ladder throws,
gotcha,
meat drags, whatever else you want to do. So
right. So broad things from functional movements all the way up to typical fire tasks that they're going to do.
Right.
All in that spectrum. What is the most common injuries you see?
So I work closely with our risk management department. The most commonly injured body part on a firefighter or on a Denver firefighter, I will say, is the spine. When we classify work comp injuries by body part, it's going to be spine, and work comp calls the spine anything from the neck all the way down through the lumbar spine.
Gotcha.
Anecdotally, I'll tell you, it's lower back. Lumbar spine is the most commonly injured body part on line. So
if you see that kind of as a common injury, is there a way to, do you guys go into it of, okay, let's look, this is kind of the main thing that these guys hurt. Do you put in exercises and things to kind of make sure that doesn't happen to the fire department staff, or is it just something that if it happens, we're gonna deal with it then?
Right. So in 2018, I had been here 3 years, and I was looking at all the injury data, and we quickly recognized it was lower back was the most commonly injured body part. So what we did is we packaged what I called the low back workshop, and it was basically just, hey, here's some really common exercises to stiffen your trunk and make sure you have control of your trunk. And here's a couple really easy hip mobility stretches, really easy thoracic stretches. And we packaged it as a kind of a lecture, like a 15-minute lecture and like a 15-20 minute lab where we'd actually go take the firefighters down to the gym. The Division of Safety and Training liked it so much that they rolled it out as their annual training in 2018. Risk management did tell us that lower back injuries did decrease in 2019. We can't say for sure it's because of the low back workshop, but maybe it was.
I bet so. That prevention
take it.
is,
It was. It's all workshop, man.
That's
That's all you guys.
Take the win.
Yeah, actually, that is a good win. Hey, when you talk about lower back injuries with firefighters, you probably globally that's probably the most common injury to anyone. Is it the most preventable one?
I'm not sure. I'd like to say it is. As a physical therapist, I'd really like to say it is. We train the recruits every morning here at the academy. We try to establish some of those principles that are good for low back health while training in the gym, like core control, hip strength, and all of those good things. Is it preventable? I do think it is. From the viewpoint of the culture, right? The young guys want to work hard, do all the work. What I ask them to do is, hey, take a step back, involve the team. Don't do a lift if you're not sure it's going to injure you or not. Slow down, 4-point the pram. Slow down, say, hey guys, I need help with this victim. Do whatever you got to do. Slow down, say, hey, I can't get this transfer on my own, this patient transfer on my own. I need help, okay? Or I need equipment. And slow down and work together as a team so not one guy is in there, putting himself at risk for
it's easier said than done.
I was going to say, is it hard? Because I look at you guys, right? Like all you fire guys, you guys are pretty, you look at the big guys, you guys are specimens, right? So you get in the weight room, you're doing deadlifts or you're doing whatever. Ego take over a little bit? Do you have to get in there and be like, all right, Brian, there's no need to pull 405 today on your deadlift. Let's relax a little bit, simmer down, and just go back in, just to protect that back. You see that a lot? You get a lot of guys in the weight room. I can see how that's happening, and ladies as well. Same kind of thing. The ego kind of takes over sometimes.
Yeah, it happens. We had risk management called me once and asked why there was 3 members reporting low back injury from one station on one shift from doing deadlifts. And I won't name the station, but
part of that.
No, one station one. I don't think so.
Yeah, right. So, but that being said, there's a lot of things you can do, just like trunk coordination, making sure your hips and shoulders are together, trying not to rotate under a load to prevent those injuries. The other thing is in the gym is training in awkward positions like kneeling and half kneeling in rotation, so that when you get to a live situation, you don't freak out, and that's usually when those types of injuries happen. But that being said, so there is preventable ones, and those are the ones I try to educate on. The unpreventable ones are those heroic efforts that firefighters do have to make from time to time. So those are the unpreventable ones.
And we know that's going to happen. That's what we signed on for. That's just unforeseen, but willing. We're willing to do it, right?
That's why it takes a special person.
Oh,
absolutely.
Yeah, appreciate it. Now, especially on a scene, we don't have time to warm up. It's not a warm up. It's just a lift, right? But when we're in the weight room and we're doing things, how important is that warm up? And do we need it? Like, it's been kicked back. Like when I was growing up, when you were growing up, we did a lot of static stuff, right?
Oh yeah.
We just kind of plop down, static stretch our hamstrings, static stretch our quads, this, that, and the other thing, called it good, and we were at practice.
Count to 10.
Yeah, basically, I count to 10.
Touch your toes.
And now
I can do it.
Right? We need that dynamic. We need that dynamic warm up, get that blood flowing, get warm before we stretch anything. How long is the proper warm up? What are we looking at? Oh, because obviously this is a fitness oriented podcast. A lot of people do some sort of fitness regimen. What are we looking at for warm up? What should we expect? What should we plan on? Because we're all horrible at it. I'm the worst at it. I can point the finger right at me. I'm terrible because I try to get in and out.
Not enough time.
And
always the excuse, right? I got to get
times
in,
yes,
get out.
But so is preventing injuries. Like we're working out to get fitter, and if we get injured, it's less time we can be in there working out. So what's your thoughts on that, Casey?
Well, honestly, I think the biggest thing is you do have to increase the temperature of your body and the muscles so that they're more pliable. So, whatever raises that temperature, a minimum of 5 minutes in my mind. But
Gotcha.
we do use the dynamic warm up here, and what you want is muscle activation, right? And you want to start exposing those muscles to a little bit of load and a little bit of strain. So, here at the academy, we teach a dynamic warm up. We have 3 different dynamic warm ups that we'll take the recruits through, so it doesn't get too monotonous.
Sure.
So that's my go-to. Honestly, if I'm in the gym, 5 to 10 minutes, any cardio, low and slow, followed by my go-to is I like a warm-up set of whatever I'm going to be doing. So sure. I know, Brian, you like CrossFit, pick your movements, go light, body weight, go through 3 rounds of 10 on those, body weight or light load. Or if you're going to lift heavy that day, grab a set of 20. That's easy for you on bench, squat, whatever it is. Just get that movement lubed up and get those muscle groups turned on and ready to go. So
do you, on your dynamic, do you kind of go one body part more than another, or everything all together, just trying to hit everything to be ready to move?
We try to make it full body. We try to make it full body. And it's mostly weight bearing, right? So, it's pretty traditional walking lunges, plank rotations. We'll use the PVC bar, overhead squats, side flexion with a PVC bar. It's pretty standard stuff. We just package it and make sure that we're getting shoulder mobility, hip mobility, thoracic mobility, and then warming up the body to move as well. So,
and I know this is a tough question to ask, but we've got the gamut of athletes that we work with, from endurance athletes that are doing half Ironmans to full Ironmans to people that are just sticking with short Metcons and heavy lifts. Should we just kind of follow that same warm up for that whole thing? Just as long as we're getting that body temperature raised, we're getting that pulse rate up, we're getting the blood flowing and everything's warm and pliable. Are we good? Or do we need to really tailor make it for every kind of workout?
As far as specificity goes, I think there is some sport specific benefits.
Okay.
But the one thing I would introduce is just, multiplanar, working in those, like if you're an endurance athlete and you're just going in that frontal plane, making sure you're hitting that transverse plane and that sagittal plane a little bit, just to get those joints exposed to a different load and range of motion, because they're just going to get pounded on in that same pattern, whether it's your Metcon or your endurance event. So
right. And like you said, Metcon, CrossFit, that they get bagged on for a lot of things, but one of those things is there's not a ton of rotation. Right. There's not a lot of movements we do that there's that rotation. So we got to remember to really put that in if we're just adding some accessory stuff or strength stuff, making sure we're really trying to hit that. Now, Casey, this is going to be another question that's tough too, but I have a ton of questions for you. But what do you think is the most underutilized or undertrained movements? I know that's a tough one, right? But
right.
Where are people not doing enough isolateral stuff? Are they not unilateral stuff? What do you think? So
you brought it up. I love unilateral. What I would say is weight, single limb weight bearing, single limb body weight control.
Okay.
So you're doing your bicep curls, do a set of 10 on one leg, do a set of 10 on the other. Okay.
Oh, gotcha. Okay.
Putting yourself in a plank position on one arm, or a side plank position on one arm, and then working whatever movement it is from that position.
Okay.
Or even working in half kneel, whether it's a press or a curl or a row, whatever it is, those are really good single limb weight bearing positions where you will get exposed as far as whether it's a balance deficiency or whether it's a trunk control deficiency.
Gotcha.
And then your body will have to figure that out to make it right. As far as a really neglected part of the body that is commonly undertrained, I would say, is just that lateral pillar. So whether it's a side bridge or a side plank and doing whatever sort of lifting in that position, I think that's the most underutilized. The pull-off press from a tandem stance. Those are, I think you get a lot of bang for your buck there in underutilized muscle groups that are commonly untrained. The other thing is in a lot of these people that are, big bad athletes, they'll quickly realize, oh, I'm strong as heck on this side in weight bearing. What's going on this side?
Yeah.
I barely do anything, right?
Right.
And that's almost always the non-dominant side. So if they can dial that in and then accommodate to that training, something really good's going to happen. Whether it's getting that oblique to fire, or maybe my scapular stabilizers are weak, or maybe it's my hip stabilizers are weak. Something really good's going to happen there.
And then training like that probably keeps us from getting some sort of like compensation injury, probably, correct? I mean, because we're always trying to compensate one side of the body for the other side of the body, and that can lead to things down the line, right?
But you think about like our athletes that we're training, and we've all trained, just bench press or dumbbell together, but not one side. And how many things we do in our lives are just one side, right? Think about, you're playing football, you're blocking somebody, you're hitting with one arm. Volleyball, you're coming down, making a swing.
Yeah.
So that's such a good point to bring up. And remember, as you are programming for others, to put those into your programming, because every aspect of life, that's what you're doing. It's one side or the other. Rarely are we doing two body parts together.
Two of my favorites for upper body are, you get on a bench and you do a bird dog row. So you get on a bench, grab a dumbbell, assume a bird dog position, and then row. And you will see people just fly off that bench, and then they have to accommodate.
Right.
The other one is a single arm dumbbell bench, where you hang half of your body off of the bench. Now, when I bring that weight down, it's trying to tear me off the ground, and I have to use that anterior core sling to stabilize me and get the movement done. As far as lower extremity is concerned, single leg deadlift, single leg sit to stand, anything in that single leg series, Bulgarian squat, all of those are
painful. That
one is
already. So
I
painful.
feel it already.
Bulgarian split squats they're the worst.
But when you realize an asymmetry, if you're super strong already and well trained, and you realize that asymmetry, that's going to carry over to your core compound lift if you train that. So
sure.
That's where you get a big bang for your buck there.
Now, Casey, I have another question for you that probably a lot of parents have, and we have this. This is a typical athlete we have at Wiggins. Typical, like with your daughter, your son. We have, like when we grew up, we're multi-sport athletes. It's just kind of what we did. Now it's kind of morphing into, we have a lot of student athletes that are doing one sport, but they're doing it almost year round, right? And that's kind of what's helping them get into college. Like that's what colleges want to see them play the high school sport. They want to see them play the club sport. What do we need to do with these athletes? Like we have one here, we have a couple here, including your daughter, that is volleyball almost year round. What should they be training so they're not getting an overuse injury and say their shoulder or something like that? Like what specific?
We've seen that in the past. We've had a few girls that get into season. They've got their season. They go right into club. They get right into summer. And they come season again and their shoulder's shot. So it's what should they be doing? I mean, is it something like, hey, they should have crossover symmetry, or they should have this or that? What are we looking at to protect those kids? Because they're driven to do it. I have one girl right now that plays volleyball almost throughout the year. She's playing basketball, and then also asked me for another program to increase her vertical jump. And it's like, man, we're trying to protect them for not doing too much, but I truly, truly respect that athlete that wants to do more and get better. But how do we protect them? And that was a long, rambling question to get to. How do we protect that kid that is just super driven for that one sport?
Right. So in adolescent athletes, the biggest factor there is overuse.
Right.
So it's that part is unavoidable and it's unpreventable. You're right. We're getting this competitive culture around these club sports where if you even want to be on the varsity team, you have to be a part of that club in the off season. You have to be competitive. You have to be there. My biggest thing, because I used to treat a ton of high school baseball players. My biggest thing is rest. When can they rest? In baseball, we used pitch counts.
Yeah.
But before, at the end of a long season, they're going to need at least 2 weeks of rest.
Okay.
Now, before season, that's, hope, they're going to be on the court. They're going to be drilling, but hopefully they're in a spot where they can really take to the strength training process to build those shoulders up, build those hips up, because we know once we build them up during season, they're just going to deteriorate.
Right.
So the more durability and strength we have at the beginning of the season, I think the less prone you're going to be to injury during the season, and especially towards the end, because it's hard to maintain.
Right.
Yes, crossover symmetry is my favorite.
Right.
Work with them closely. If you're in season, using that eccentric program to get rid of the soreness and keep those small rotator cuff muscles, scapular stabilizers activated.
Gotcha.
That's plenty good. Also, the hip halo or the crossover symmetry hip halo.
I love that.
Yeah.
Yeah.
It's for in season. I just think it's a great thing to keep all those deep stabilizers of the hip turned on. You're going to protect your knees, protect your feet, keep your lower back healthy. So those are the two products I would encourage.
Sorry about that.
I was just so to summarize, rest them when they can rest in the off season. In season, hip halos, crossover symmetries, protect those small little muscles.
And ideally, you would do it before and after practice or before and after an event. But
okay,
it's not very practical. But ideally, you would.
We have all of our coaches and everything here. So let's say we just get out of volleyball season, right? You make it to the state championship rounds, then you start basketball Monday.
Yeah.
So there's not really a 2-week window there. What would you suggest our coaches do kind of between season? There's not a lot of between seasons when you're successful at what you're doing. How do you go from one sport right to the next? Because you're not going to get that 2 weeks of rest. But what can we do to kind of prevent injuries in the future instead of just getting right after it right away and going hard?
That's a $1 million question right there.
Right. Yeah.
I was hoping you had the answer.
If I had the perfect answer for that, I'd probably be a millionaire. That's an extremely tough question. Again, the biggest factor is overtraining. So, I don't know if I have an answer for that one, buddy.
I guess just kind of getting what he's talking about is just they're switching sports. We just need to learn to step back as coaches and roll them in slowly.
Yeah.
Still allow them to have kind of that rest, but roll them in slowly. I think the best thing
that would be my best answer is just have a graded exposure, have a real light introduction to the basketball season.
Going through the fundamentals, doing those type of things instead of getting out there and
because we have a lot of that.
Jumps.
I mean, we're at a small school here in Wiggins where you're the core of one team that's truly successful might be the core of that next, the next sport, give or take a few girls.
Right.
But we lean on them so much, and we're just like, you're young, you're good. And then you get to my age of 46, you're like, oh, holy crap, I can't do that anymore. So it's and I'm sorry to throw all these at you, Casey, but we just have a lot of questions, and I know a lot of parents worry about their kids because nowadays they just don't have a lot of time off.
Right.
And when I was growing up, you did. Yeah. You had some summer leagues, and then you played in your season. But right now, like his daughter went from a state championship run in volleyball to now she's playing basketball full time plus club on the weekends.
And then plus we expect them to get up in the morning, go to weights.
Yeah.
And it's something that definitely takes a toll on their bodies. And I think we're seeing that. I think we saw that with our wrestling program last year. Towards the end of the season, we had some guys that probably weren't as healthy as they could have been and as rested And I think it was just wearing them down. And I think we did a lot of that in the weight room.
Well,
So trying to back that off a little bit and
and it's like in-season conditioning, right? We look at in-season conditioning as like, we're going to make these kids, get them in shape, get them strong, but it's like, man, we're just trying to maintain them.
Yeah.
We just don't want them falling off.
It doesn't go through a coach's head.
No, it's like, it's like, why are these kids out of shape? It's like, they're not. They're just beat down, right?
I was talking to he was one of the strength coaches for the Rapids, and he brought up a really good point. His point was, when you're in season or even preseason, when you're doing all of your field work and drilling, or court work and drilling and scrimmaging, that's where you're going to get your cardio in. Okay. Right. Conditioning should be sprint work, agility work, that short, fast twitch burst, short-term energy system training.
Okay.
It should, so I really liked that approach, because he's right. You're going to have your heart rate up the entire practice while you're competing for a spot.
Right.
And then make your conditioning a little bit more beneficial by backing off that heart rate piece and just really chasing that, that short and midterm energy system, and with your short and midterm sprints or agility work. So
I guess it doesn't make sense to condition in the same energy system that you've already conditioned all practice.
Right.
You need to hit all three, the best you can.
I like that.
That is good, and that's a good reminder as well. Now, I'm going to ask you, coming from the fire side, and then we're going to kind of morph this into everyone. So this is not an easy question, but this was a question that was asked, replied to our last episode, and we were talking about resolutions. We were talking about goal setting, this and that with Brian Cash. And what was asked was, how do you get somebody who's on the total other side of the spectrum of not real athletic, not into working out, in fact, not even motivated to work out? And he said, in fact, this might be a big thing on the Denver Fire Department, is how do you motivate the unmotivated individual to work out or to make a change? And it's a super hard question, I know. And we deal, like yourself, you deal with recruits, all the time, which they have no choice. In my mind, there is no choice. If you're on a fire truck, in my mind, there is zero choice. Kind of talked about it last week. The ink is dry on that contract. You've made that contract with yourself, your crew, and the community you serve when you're on a fire truck. There's no room.
No going back.
No, you are in shape or you're not, because I tell you what, and we've talked about this before, Casey, if something was to happen to Trent and he's my crewmate, and I had to look at his wife and say, I couldn't give 100% because I wasn't in the shape, I need to quit that job right now. Right.
Right.
I need to be done. I failed myself. I failed him. I failed his family. Now, that's as a firefighter on a truck. But just the general population that doesn't have that on their plate, doesn't have the I signed that I'm going to do this. How do you motivate the unmotivated person? How do you get them to try to make a change when they know they should, but they don't like it?
Right. So, I've been doing this for a long time. I work with injured people a lot. Injured people are motivated because they want to get healthy again.
Right.
When you're talking about the common population, if we're talking about, people about our age, I would honestly say start with a medical physical.
Okay.
Get your blood work, get a body composition, see where your health's at. And that's probably, to me, at this age, especially if you're parents, that's going to motivate you to make changes if you need to. Scared straight. Right.
Yeah.
Right. So, and that's where I would start. When you're working with firefighters, it is a lifelong commitment to fitness. A lot of the guys say that working and drilling and training is how they stay in shape. And there might be an argument for that. But people do come to us for, hey, I want to get in shape. I want to get healthy. What do I do? And we'll start with an in body, hey, let's see where you're at. And then we'll keep track of that. Now, what do you like to do? What are you going to do that's maintainable and you're going to be successful at? What are you going to be consistent with? So that's where, as far as exercise and physical activity goes, that's where I push people. Don't do what I tell you. You tell me what you like, and let's build around that. So,
right. That's a great plan of action. And so I bet you do see it in fire though, as well as in the fire department in every walk of life. As you age, sometimes we hurt, sometimes we just don't feel like it anymore. We want to promote and move on. So what do you do to those people that they used to be kind of in shape? They've done it, just kind of wearing on them. They're aging and they're not wanting to give the effort they have before. Have you seen that? And how do we get those people back to doing it again?
Well, and I think, and I'll step in here real quick. I think that one, you see that a lot, and you see that a lot in the fire service. They're like, I've been there, done that. The young guys got it. However, those people are looking at retirement, and you want to have a fulfilling retirement. Yeah. You want to have a healthy retirement, and my goal was always to retire healthy.
Shoot, you're about 3 years away, aren't you?
I'm not far. I'm less than about 8.
Yeah. 8 years,
so anyway, my goal was always just to retire healthy so I could have a long, loving, happy retirement. And I think that's what we need to get those guys and people our age, like, hey man, we're not nearing the end of our life. We're halfway. We've got a whole life left to live. So maybe that's time that we kick it up a notch, and we were talking about it last week with like Casey saying is find what they like, try to get them to do it for 3 weeks to a month to create that habit. And then you tailor stuff from there. But if they're truly that unmotivated, we have to find a flicker. We have to find a spark to ignite that fuse a little bit for them. That's why we do have peer fitness training and stuff like that at DFD. And Dr. Stoneberger is a huge part of that where, man, just go and talk to somebody, get a program. Like group classes or working out with somebody else is huge because there's always somebody there to hold you accountable.
Accountability buddy, yeah.
And just to have fun, right? Like working out by yourself is not always fun.
Right.
But working out with a buddy or a group of people could be great. Yeah. And that might be what that person needs, right?
Well, I think that spark for the end of the career could be like, well, hey, you like to hunt. You like to play golf. Well, let's train for that,
Yeah.
So maybe it's not the job, but you'll stay in shape for the job and your golf swing will feel better.
Yeah.
You'll send the ball further. You'll be able to hike in more to hunt. Those types of things. Carry more of your harvest out. Those types of things.
Kind of finding your why, whatever your why is, you find that why.
Exactly.
And then go get it.
Yeah, and maybe at that part of the career, it's not the job that truly motivates them. It's like you said, your hobbies off of the job, getting to retirement and having stuff to do. Casey, I know we're pressed for time. Truly, truly appreciate you coming on. Would love to have you on again.
Right.
I know the questions, there was a no heads up on the questions really. So a lot of them are really hard. But it's just, I think a lot of people have those questions, right? Especially when it's about their kids, about their student athlete.
And it's themselves and their aging.
Yeah. And trying to basically giving their kid every opportunity for every desire they want, but also worried about, man, are they trashing their body doing this?
Yeah. I mean, and at the end of the day, I think that training process and that dedication and that perseverance, there's no substitution for that for developing adolescent. I mean, it's a great experience, and I wouldn't take that away from anyone. So absolutely.
Well, thank you so much for coming on. Truly, truly appreciate it. Would love to have you back sometime because I know I could do this a number of times with a lot of questions.
Oh, we could have tons
about
of questions.
Strength training. Because you should see this beast in the weight room.
I like it.
I tell you what, when he said I'd be lifting heavy, my heavy is his warm-up sets.
You're lifting Brian for your warm-up sets, aren't you?
Basically. Yeah. So he could come in and teach us a thing or two about strength training. He's in charge of the recruits. I mean, he gets them prepared to go to the streets. And his strength programs for them are basically pretty much like he told us. It's the half kneeling stuff. It's the the landmine stuff. It's Zercher squats. I mean, it's stuff that you wouldn't even think about training, but when you look at it, you're like, that makes total sense for the job.
Big responsibility. Yeah. And thank you for that. And Dr. Stoneberger, with that, we got Hero Wadapalooza coming up on April 8th here at the school. So you said you're a beast in the weight room. I'd love to see you out here in 24 hours getting after all those Hero Wads with Baker and the bunch.
I'm this close to signing up.
Yeah,
that close. If you receive that golden ticket,
I say check your email today. Check your email today. But that's going to be a ton of fun. Love to have you out here for that.
Gotcha.
There's going to be a lot of guys and it's going to be a group of guys and gals just herding each other and pushing each other through. We'll all make it through.
1 o'clock in the morning is going to be brutal.
Yeah.
Yeah. Do you
know that?
Yeah. Know that for a fact.
Awesome. I'm this close to signing up, fellas.
We got to get you to cross that line, get those together.
That's right. So that's great. Thanks so much for spending time with us. Have a great rest of your day. Tell everybody we said hello. And Dr. Stoneberger, thank you so much. On behalf of Brian Baker and Trent Kerr, thank you, sir.
Thanks, fellas. Have a good day.
No problem.